And then let's get live.
Yeah, I see it's recording.
Cannot minimize while
Nice.
you're recording.
Nice.
Screw you. Okay, now, but you got to let me go live. So we're going to go live. Let's see. Add title. Sure. Go live anyway. I'll tell you when we're live. We're going to be live soon.
We're live now.
Are we live now? Oh, snap. Oh, snap. This is so fresh. And listen, done redirecting to Facebook. Oh, yeah. And I got to try and do a little bit of promo on the Facebook page, too.
I'm right.
Are we live for sure?
It says it on my screen. People are watching.
Okay.
There's now streaming live on Facebook.
Okay, perfect. What I'm going to do is just make sure on my Facebook, on my phone, number one, I got to just plug it, send it off to all our Facebook people.
Right. Sumon, I see you got your microphone there. What are you drinking?
There's a little bit of
vodka, you know?
And my Kermit the Frog microphone.
Let's see this. Join this event. No, that's not what I want to do. Sorry, people. We're almost there.
The hardest part about being on this is not touching your nose. My nose is the
right
thing right now. If an ID doc touches his nose on a Facebook Live thing, it just doesn't look good, you know?
Oh my goodness. I did one of the promo videos, right? I think it was for your show actually. And they were like, you touched your face 56 times. It was ridiculous.
Everyone calm down, eh? Like, holy moly. Yeah, we're human.
Exactly. Like it gets out of control quick.
Who's like the face touching police?
Exactly. All right. No, yeah, we are live. Yeah. All right. I see people coming in. Oh, yeah, this is going to be fresh. Okay. Now I'm happy that we are in the mix. We are in the mix. All right.
I'm excited.
Okay. All right. So I don't even know where to begin. Let's see. So welcome everybody. This is our second ever live cast, and we got some big wigs in the mix. Again, we're doing it again on the Quadcast Nation. I'm loving it. But before introducing our guests, I just want to tell you a couple things. Number one, I want to quickly, not to be a little bit Debbie Downer, but I just want to thank a lot of people that sent messages out after that article that was published yesterday with CBC about, you know, my personal race experience with racism in life and in medicine. And I was extremely overwhelmed with the messages that I was receiving in the last 24 hours. I want to tell you it really meant a lot knowing that so many people cared and saw the value of that. So I just want to take a second and thank all of you guys. I also want to thank Julia Hajar, who's taken time of her busy evening, who's our head of social media and has a new website, A Spoonful of Science, because she throws down like nutrition knowledge all over the place. So Julia, thank you for setting that up, and everyone check out that website. It's wonderful. Another shout out to Kim Sutton. She's setting up our new website, solvinghealthcare.ca. You can see the nuts and the bolts of that right now. But it'll probably be in full effect in a couple weeks. So thank you, Kim. If you like her services, there'll be links to her services in the show notes and in the comments section. Next, I want to thank our official sponsor, the Better Together Project, put on by Haley Harluck. This is a wonderful initiative. She basically got together the spouses of physicians just because of the struggles, not only through COVID-19, but also beforehand. But this really took off when COVID-19 hit. And now they're having a live virtual event on the 9th of July If you use promo code Solving Healthcare, you'll get 10% off sign-up fees. And I just want to give, mad love to Haley, because it's amazing what you're doing. We're doing an interview with you at the end of the month. And my wife is going to be, Kathy will be showing up at the conference on July 9th. So I just want to thank you for that. For those that are just coming in, if you want any of the audio or the video or the show notes to this episode, just type in ID into the chat box or to the comment section, and you'll get, we'll email that to you in the next day or two. I think that is set up. Actually, I'm not even sure that's set up, but you'll find out soon if you get prompted. The other one we have is if you type in news, you'll get, you'll sign up for our newsletter, which is amazing. Our team put together some beautiful stuff. You're going to get what's upcoming on our show, some unpublished material. So yeah, sign up there. Merchandise. So as you know, like, hold on, check out this. I'm going to do my Vanna White or Vanna Black right now. Dun, dun, dun.
How do I get one of those?
Yes, that's a great question, guys. So, you'll see the links to our store. And remember, all our profits go to local charities. And this month, we're going to Bridges Over Barriers, which is our local charity that goes to kids needing, for their basic needs. So like shoes, clothing, whatever they need to get by. And this has been a huge hit during COVID because the needs have been massive. So support the show and support Bridges Over Barrier. And lastly, free merchandise. Guys, if you guys put in, I forgot how to do this. You post a rating or not a rating, what's the thing you call it? Comments and a rating. You'll get a 5-time entry into the draw to win some of our merchandise. And Peggy, I hope you're listening. Peggy Talon, you're the winner for May. You're going to get whatever you want. I'm not sure what we.
Go.
Yeah, she's a true baller. She's been a huge advocate actually for the Black Lives Matter, and I couldn't think of a better person to win that award. So thank you so much. And guys, wherever new listeners, because there's going to be some, subscribe to this bad boy, man. We're changing the boogie. You're about to witness some knowledge being thrown down by these two wonderful infectious disease docs. I'm going to start with Dr. Isaac Bogoch, ID trained, obviously, and also Harvard trained.
Where's that?
Oh my God, that's only the second person from Harvard that is entered the show. You would have seen him on CBC, City News. Works at Toronto General, and it is a pleasure to have you, Isaac. Thank you so much for joining us.
Thanks for having me on. I've been really excited about this all week.
Oh, me too. Thank you so much. And Sumon, I mean, do we need an intro? This is his third time on the show, Dr. Sumon Chakrabarti, Trillium.
Of course, man.
You've seen him on the
third time.
Yes.
Holy.
The trifecta.
And the hat trick.
The hat trick, absolutely. More McDavid than Matthews, though. Seen him on CTV News. As I said, this is his third time on the show. Full of knowledge, Sumon Chakrabarti. Welcome back.
Great to be here. Thanks so much for having me.
Absolutely. Guys, you know what? We're going to have a good time. I'm sorry. There's been so much BS in the world these days. COVID, freaking all the violence and the racist stuff that we're seeing. I know it's a serious topic, but let's have a good time here.
Yeah,
absolutely. So Isaac, maybe we'll start with you. Where do we start? So the WHO has given us a few statements now in terms of asymptomatic spreaders, saying, hey, maybe these guys aren't as haven't been such a big proponent to spreading the coronavirus or COVID-19. What's your opinion on this, either from the statement or from what you've seen as an ID doc?
Yeah, so let's start with the statement. I mean, what a mess, right? They start a couple of days ago, they say, hey, oh, by the way, asymptomatic people don't really spread the infection. And then, of course, those of us who follow this were saying, excuse me, that doesn't sound so accurate. So the next day, which was yesterday, they're like, oh, just kidding. They do. And, I appreciate that, like, everyone's entitled to make mistakes. We all make mistakes. I'm looking at you, Dr. Chakrabarti.
What do you mean?
We all make mistakes. And that's fine. But I mean, they've got to get it right. I mean, in all fairness, in all seriousness, you got to get something like that right. And it's important. There's a lot of credibility issues, especially with this pandemic. There's a lot of politicization, and it's a problem. And the WHO needs all the credibility they need. So that was a mistake. Okay, mistakes happen. I wish their clarification was a little bit better. Unfortunately, it was not the most clear message yesterday when they tried to sort of fix their public relations gaffe. But in all fairness, like when we actually look at the data, this has been screwed up from the very beginning. And three of us here are physicians, right?
Yeah.
So we speak a language, and when we say the word asymptomatic, it means something to us. It means there's no symptoms. Point final. That's it. You have no symptoms. And when we're talking about asymptomatic spread, we really should talk about people who have no symptoms, and we mean no symptoms throughout the time they get the virus to the time they no longer have the virus. That's what I mean by asymptomatic. Now, there's another term, pre-symptomatic, which means people have no symptoms for the first couple of days. They get the infection, they have no symptoms, they're able to transmit it. They have the virus, they're shedding the virus, they're transmitting the virus, they infect people around them, and then after that, they develop symptoms. So that's pre-symptomatic. And then the last term is called posse-symptomatic, which basically means that they have very, very mild symptoms and people just might not come to medical attention. You have symptoms. You might have a small fever. You might have a small cough. You might have myalgias, whatever. It's not severe enough that you're going to seek medical care, but you just have mild symptoms. So asymptomatic throughout the entire course, pre-symptomatic, and posse-symptomatic. And we've done a very poor job as a medical and scientific community from honing in and defining what those are. And the early data confuses those. Even some of the more recent data confuses those. And then that primary data gets modeled, so that gets amplified in the further studies. We need to do better. Now, certain studies are looking at this more closely and are defining this, and that's appropriate. But like, we're 6 months in, we should have been doing that from the get-go.
Yeah. Any further thoughts to that, Sumon?
Yeah, and I think that for the echo part that my much better dressed colleague, Dr. Isaac Bogoch, says here.
I thought it was horrible, man.
It's good to have the shake-up. It's good to have the variety, man.
Yeah.
So
if I ever get invited back, I'll
that's great. See, it's actually a very good point about the credibility. I mean, we all make mistakes, but this is the kind of thing you really want to get right, especially because there's so much confusion. One thing I will say, and this is actually quoting my good friend, Dr. Isaac Bogoch and Dr. Alan Detsky, is that at this time, I think people are thirsting for good news. And, it would be good news if asymptomatic spread wasn't the thing. And that's, I think, why people jumped on this. Hey, look, all of a sudden we don't have to worry as much. And that's clearly not the case. Well, I shouldn't say that. It may be the case, but we definitely don't know. So let's take a look at this, look at the data, and then make our conclusions. I don't think I'm going to change anything majorly based on this.
Yeah. Can I make a bold prediction?
Yeah, make a bold prediction, actually.
Okay. At the end, I totally could be wrong on this. But if we look in the crystal ball, 6 months from now, we're talking about the same thing. Here's what I think is going to happen. Number one, we're going to know that people who are pre-symptomatic are still going to be involved in significant transmission of the virus. I really think that's going to be the case. Mm-hmm. The people who are posse-symptomatic, meaning you still have, muscle aches and pains or mild symptoms, I bet those people are involved in transmission as well. Truly asymptomatic people that truly don't have any symptoms from the very beginning to the very end of the time the virus is in their body, I would bet, and again, I have nothing to back this up, but I bet that they actually don't have a significant role in transmission. I really don't. I bet that,
I share this.
Maybe I'm way off on this, but if we truly define the asymptomatic person from the time the virus gets into the body to the time they clear the virus, my guess would be that they're not going to be responsible for a lot of transmission. I could be way off on that. If anyone's watching this, prove me. Maybe I'm wrong, and that's fine. I accept it. But let's actually get the data. That'd be my prediction.
And is it fair to say, as a non-infectious disease doc, when you look at other respiratory infections, you know, and I don't want to say it's, you know, this is not the flu, and, you know, so I'm just being clear there. Like the truly asymptomatic patient, are they often spreaders as, are they often non-spreaders as well?
They can be. They certainly can be, but they're probably less likely. And, you know, some people shed more virus than others. And I think we're going to see, you know, a handful of truly asymptomatic people that are just shedding a lot of virus for some reason. And those are going to be the people that are spreading. I just think they're going to be in the minority. You know, same with the symptomatic people. Some people just shed a ton of virus. There's sort of this 80-20 rule where 20% of the people are responsible for 80% of the infection. So I really think that that's going to be the case. Like, I know there's other respiratory viruses, but we can, you know, hey, we're talking ID, we can take it to like dengue and some other cool viruses as well. But like, there's a lot of people that get dengue and they don't have symptoms at all. A smaller proportion of people with another cool virus, chikungunya, these are mosquito transmitted viruses, but it's not unheard of to have a virus of, you know, many different types of viruses and have no symptoms, but still be responsible for transmitting it. Usually it's the symptomatic people that are more likely to transmit it because the viremia or the viral load in the respiratory tract is higher. That's usually the case.
And this is a bit of a tough question, just because, you know, when we talk about,
Sumon,
Sumon,
give it to me.
Actually, I'll start with you, because like this virus has been unique in so many ways. And like we talked about, you know, the transmission of asymptomatic people and so forth. But what surprised you the most, guys? Like in terms of this, I don't know how many months it's been since we've been introduced to.
We're in the 6th month now.
6th month.
Yeah.
Like, is anything, maybe nothing surprised you, but has anything surprised you, and to what extent?
One thing to remember before I answer this. So like, if Isaac has seen a certain number of COVID cases, I've seen one more than he's seen. Always. Okay, all the good stuff. Always one more.
Can I make a disclosure?
Yes,
Full
yes.
disclosure. People haven't figured out yet. Like, we're pretty close buddies, and I basically talk to Sumon about 4,000 times a day, either in texting or calling. Even though we're at different hospitals, like, I talk to this guy all the time, and now I'm out of the hospital and I got to see his ugly mug on the screen here. So
he has a face for radio. It's, you know, we were, but yeah, it's there have been a couple of things that have surprised me. I think one of the big things is that, not that it's we haven't seen this with other viruses, but the explosive way that it's been able to kind of come onto the scene. You know, the asymptomatic, or pre-symptomatic, that type of spread. But the other thing I think is the actual clinical thing that all three of us have seen. And that's the idea of these people that are getting sick, but then they're stably sick for so long, and then they kind of get better. Right. And, you know, Kwadwo, I'm sure you've seen that in the ICU, and I can't explain it. These people that, you know, oh man, this person's going to be in the ICU forever with a trach. And then 3 weeks later, they come out. And that's the kind of thing I think that, well, clearly it makes sense why these patients can overload a healthcare system if we're not careful. But the way that it is prolonged like that, you know, there's other things too with the clotting stuff. We see that with other infections as well. But it's just that this is somewhat distinct from other coronaviruses. And I find it very, very unusual.
I have two.
Yeah.
One sort of dorky and one a little more serious. The dorky one is, I love this loss of smell and taste. I just think it's fascinating. Yeah. I think it's fascinating. And it goes well beyond having like a stuffy nose. Like, it's a real phenomenon. I mean, we're seeing, like, it's one of the first things I ask people in the hospital when, if they're coming in and we're suspecting COVID-19, and like, just total transparency, you know, we're on the COVID wards. I mean, we're dealing, and we're in the emerge with undifferentiated patients. Like, you know, you're wearing your PPE, but, you know, we're human. And like, I wonder, like, oh shit, was I exposed or something like that? And every day when I'm making breakfast for my kids, I do the peanut butter smell test. And I'm like, no, I think I'm still good, you know?
I'm good.
Like, I really think that the loss of smell and taste is just a really fascinating feature. You know, there's some cool studies that have come out that looked at the high prevalence of this, and, you know, it's the duration of it and all that stuff. I don't know any mechanisms yet, but it's pretty interesting. I just think that's fascinating. I mean, it's kind of helpful clinically. I don't know. I really think it's interesting, and it's helpful. It's
pretty specific. So, I mean, in the context of somebody coming in with fever or respiratory symptoms, but no, I totally agree.
Yeah. That's my dorky one. My other
your second one,
was, you know, the thing that kind of sad actually, but like, I don't know if this is the right avenue, and maybe I don't want to take it in this direction, but like,
Do it.
you know, we're in the era of social media. We're in the era of, everybody's opinion because they're on Facebook or they're on Twitter or they're in the news or you're walking down by them in the hall. And, there has been, I think there's been some very good science communication in the media. I think in general, the Canadian media in general, of course, no one's perfect, but in general, I think the Canadian media has been very good and very fair. Yeah, there's been a few articles where you sort of roll your eyes. And in general, I think people who are talking about this publicly, there's a pretty diverse group of voices from, ID, public health, medicine, sociology, economics, you name it. Generally, the message has been on point and interesting, and even that we're allowed to have a diversity of opinions, and I think it's wonderful to see that as well. But the disappointing thing, the surprising thing that's also somewhat disappointing is, you see some people who should know better, some scientists, some doctors, some public health providers jump on to particular trends or knee-jerk reactions to certain data. And you're like, where are those critical thinking skills? Where's the scientific method? Where is your ability to be a doctor, a public health provider, or a scientist? I don't think it's common, but it certainly is happening, and it's visible, right? It's on Twitter, it's in the media, it's in conversations in the hallway. And I mean, I'm not a fan of that. Luckily, it's rare, but it has taken me by surprise a bit throughout the course of this epidemic.
I want to echo the same thing, Isaac. Like you wonder often what is driving that, whether it's, just to be sensational and get some more visibility or just fear, but there's been a ton of stuff. And this has been one of the most challenging things is like the dissemination of content and knowledge. Like the example we often use in the ICU is like when we saw that New York data for ventilated patients, they were saying like over 80% mortality and all this stuff.
Right.
And I'm like, we're not seeing that at all. And like you would see people say like, "What's up, honey bunny? What's up, honey bunny? Hey!" For those listening to the podcast version, we're seeing Sumon's lovely daughter.
I heard her. She said Uncle Isaac, right?
yeah, Uncle Kwadwo. Yeah. I love it. Maybe it was Isaac, but
No,
I know what you're saying. I hear what you're saying.
So we like literally, for those that may have seen it before, we did a webinar with like 6 different intensivists throughout the world, essentially saying, what are you actually seeing? Because you would get patients saying that were like in their 50s and saying like, don't put me on a ventilator. I saw, I have a Twitter account. You know what I'm saying? Like it is crazy. And so, or intensivists or clinicians saying like, oh, the prognosis is poor. I don't really think patient Y should be on a vent. Like, you know what I mean? So it was like, I've never seen anything like that before. That was crazy.
I was gonna say we all have the potential of like becoming irrational about certain decisions. Listen, I was afraid at the very beginning of this too. And I think that it's important that you just have insight into where your biases are and things like that. And I agree. Like there's been one of the things that I know it's frustrated me. Isaac and I have talked about this a lot. Is the whole thing about the PPE, the airborne versus droplet. And the thing is that. This one, it makes sense, but we have to just remember as docs, in the end, we have to be evidence-based. We have to be, willing to look at the things and go, okay, this is scary, but this is what the evidence is showing, right? And it's tough. I will say though, on one hand, I was doing a lot of talking with groups to kind of help them calm down, answer questions and things like that. Now that we're about whatever, in the Canadian aspect of things, 3 months in, people have calmed down a lot. A lot of the fear is gone. And I think that helps quite a bit too.
Oh, yeah, absolutely. Like, I think that, I mean, I'm sure Isaac felt the same way. Once you started seeing cases, knowing that we could manage, knowing that our system clearly is not getting overrun, it just felt a huge, like, exhalation everywhere.
Wow. Remember, it was like, I was traveling. I was out of town for about 2 weeks in late February, early March. It was a hell of a trip. And that was like, during that 2 weeks away, Canada just started to take off. The cases started to take off. And I got back and I remember it was this very bizarre period in like mid-March where we were sort of at this point where we were thinking like, holy shit, could we end up like New York or Northern Italy? And you were talking about surge capacity. You were probably in the neck deep in this, right? In ICU surge capacity, and we're talking about redeployment of physicians, and do we need to set up tents outside the hospital? Obviously there was, as much as people in Canada say, things are terrible and things aren't going well, I think we got to step back and look at the 30,000 vote view and realize that, of course there's things we can improve on. Of course there are, but things are actually going pretty well in the vast majority of the country. Mm-hmm. But I know what you mean. Like I was nervous because I wasn't sure what direction this was going to take in early to mid March, and things were potentially getting out of hand pretty quickly. And luckily we never made it to that state where any of our healthcare systems were really overrun. But those are some strange.
Yeah, and you guys were in the epicenter. Like my colleagues out west and even in Ottawa, we actually never really got like any surge at all. Like we were always at both sites. I think we were never more than 60% capacity. Like it was just fantastic. So we were always kind of waiting for the storm, but
the other shoe to drop.
But that's the that's the classic prevention paradox, right?
Yes, right?
Prevention paradox. People are going to say, "Oh, you overreacted. Why did you cancel all those elective surgeries? Why did everyone stay home on lockdown? Look, everything went fine." And that is the prevention paradox. Canada in general did a really good job preventing a total meltdown. And now there's these complaints now that, we overreacted and we did everything too soon or too late. There's so much armchair quarterbacking going on right now. Everybody is an intensivist and everybody knows vents and everybody knows epidemiology. And like, listen, I'm not a stay in your lane kind of guy. I'm really not. My lane is open. Everyone's welcome in this lane. Like, please, I do infectious diseases. I do epidemiology. Like, this lane is for everyone. However, if you're going to be in this lane, like, you should know how to speak the language and like, again, I'm all for diversity of opinion. It's great to have debates and arguments, but like, at least be reasonable and rational about some of these things. And, everyone seems to have jumped in the ICU lane about, everyone knows everything about vents and vent capacity. Now everyone knows about infectious diseases modeling. It's great to have interest in your field. And I hope I really hope this inspires a lot of, medical students or residents to take, career paths in ICU or ID or epidemiology or mathematical modeling. Maybe there's, high school kids or people who might be interested in this. That's fantastic too. Yeah. So I think there's, there was a few negative side effects. There's also, I think there's going to be a lot of positive side effects.
Yeah. No, I think there was a lot of positives that coming up out of this in general. I think of, for example, virtual health. I think that's going to take off. But
have you done virtual clinics?
Yeah, right
Both
now.
of you guys.
Yeah, so my clinic right now are basically all virtual, although we can bring some people in for wounds and things. Yeah. It's not the same. Yeah, but I think that we do. I don't know, have you done much, Isaac? I find that
I'm doing tons. Throughout COVID aside, we all have full-time, nothing's changed with our full-time jobs. Like, you have clinics that are stacked, you have patients that you got to see. So I've been on the phone nonstop. Basically, this pandemic has been either seeing patients or talking on the phone. That's basically rounding in the hospital or just like on the phone nonstop. Yeah, I'm running my clinics.
Listen, virtually. I was with my cousin friend a couple weeks ago. We were playing tennis. He's an orthopedic surgeon. He's just relaxing. He's at home. He's playing. He's doing these things, and because they have nothing to do right now, right? And it's just such a different experience in ID and ICU that we've just been working our butts off for the past 4 weeks.
My days suck.
It's just terrible. If we never talked about COVID again, it would be
February. Tell me about it.
It's not going to get better until, I don't know, when do you think things will settle?
But
we don't have a second wave.
Yeah, this is the question I got for you guys. There's so many directions, but I'm going to stick with this. Like, what is your sense of what's next? So I think a lot of people have consensus in terms of, maybe there's going to be a second wave in fall/early winter. But what about, how's your feeling about all this? So we've had all these protests outside. People are worried, but maybe we're going to see another surge to a certain degree. What's your guys' sense of what the next little while will look like?
Jack, you going?
So listen, I think that let's say something that's really obvious. Protest is a very important part of freedom, and the fact that we have the freedom to protest in this country is a huge thing. We just have to remember that regardless of why you're congregating, the virus doesn't care, right? I think the one silver lining about the protests, and I've been talking a lot about this actually, is the fact that it's outdoors. So I do think that that's going to cut the risk at least significantly. The problem is, of course, that when you do get large groups together, especially in the protests, you're doing things like singing, yelling, crying, unfortunately. But that there is a risk. We have to recognize that, and there are things that we can do to mitigate that risk. Do I think that there's going to be, this could surprise me. We could see that there's not going to be a major spike after this. I know that right now there's, with what happened with Trinity Bellwoods in Toronto, the current time is about 2 weeks after that. We haven't seen any major signal. I'd wait for a couple of more weeks before I conclude anything. But the point is, I think that we just have to keep in mind that everything we do right now, at least for the next year, has to be in the context of there being COVID in the background, right? Mm-hmm. Things are not going to be back to normal. I'm not going to be going to a Tool concert, and rocking out,
Why Tool?
Tool.
Yeah, that's the real question. Why did you go to? I would have picked like at least 20 other bands. Am I allowed to ask you what's your pandemic playlist? Speaking of Tool,
like
Tool's on there, Rage Against the Machine's on there, and Wu-Tang's on there. It's like the problem is that I have to do something because I'm a concert guy, but we're not going to be seeing that for a couple of years. And we just have to accept
virtually
that,
virtual bullshit.
You know what might be amazing too is like you hear the term natural experiment, but you kind of roll your eyes. But it actually is a natural experiment, right? We have your Trinity Bellwoods, we have a ton of other Black Lives Matter protests, and I'm with you all the way. I mean I totally, everyone, you have a right to protest, and I'm always worried I'm going to say the wrong thing, but I can assure you my heart is in the right place. So maybe I'll just leave it at that.
Yeah.
We'll find out sooner or later what the effect of this is, and of course the mitigating factors are that it's outside, and I think that's going to be a tremendous mitigating factor. But you see some of these protests, they're not all created equally. Sometimes people are really, really tightly packed together.
Yeah.
And no one's wearing masks. Other ones, you see people like really maintaining physical distancing with tons of mask wearing. It'll be very interesting to see if with the Trinity Bellwood saga from 2 weeks ago. I really think 2 weeks isn't enough time because like the people that were there were all, late teens, early 20s. If those people get infected, most of them are going to have a mild infection. I wonder how many are actually going to come to medical attention. It's going to be in another week or so where, if they've infected grandma or grandpa or mom and dad, that's going to be the tell. I don't think we're going to see a major spike just with those individuals alone if there was an outbreak. And of course, like everyone else here, of course, I hope there's no outbreak. It would be amazing if being outside was this tremendous protective effect. That would be phenomenal. That would be phenomenal. Then, Sumon, maybe you could go see Tool outside at an outdoor concert.
Yeah.
But in all fairness, I'm not joking.
Nickelback,
you can imagine, imagine you do the little circles on the grass at an outdoor event. Like, you could theoretically bring back some fun and normalcy in the pre-vaccine era if we really know how protective these outdoor environments are. You do crowd control going into the venue, crowd control going out of the venue, hand sanitation stations and physical distancing with little circles on the grass. Like if that truly is as low risk as we want it to be, I mean, why not?
Yeah, I think, there's, I haven't read the paper. I think it was South Korea. They were saying there was 300 and something patients, and they thought maybe one was transmitted outside, like COVID-19 patient that was transmitted outside. And I know this is not solid evidence or whatever, but at least it's something reassuring anyway. And the fact that, there's been these protests around the world. Yes, it might be early. But the other thing is what's actually going on with the virus? Because, all these places in Europe, for example, have opened up, you know what I mean? They've loosened restrictions. I think I might be getting the countries mixed up, but I saw some outdoor concerts in Israel, I believe. And,
wow.
and they've been open for, we're talking 6-8 weeks, I think.
Around that, yeah.
And they're not seeing surges. What's happening? In your opinion? I don't know if this is an easy question or not, but.
No, I mean, this is the way this virus works is, when you have so many people infected, it just looks like one just massive infection. But once you get the virus under control in different populations, and we can even take it closer to home, look at British Columbia, Alberta, New Brunswick is a great example as well. There's very little community transmission of this virus. And then once you're in those types of settings, the new normal is going, if we keep our border closed and don't import a ton of cases, and if we maintain this, we're going to see very patchy outbreaks. We're going to see, meatpacking plants. We're going to see a daycare center. We're going to see a high school. We're going to see a wedding or something like that, where, someone with mild symptoms, maybe no symptoms, who just happens to be shedding a lot of virus is going to infect 3 or 4 people or more. And, these are called super spreading events. And I think this is what we're going to see in places that have decent control of the virus. As Sumon pointed out, this in the pre-vaccine era, there's no certainty, there's no zero risk place. And even with all the control measures in place, even if we do everything right, we're going to see this. And we did see this in Alberta. There's been Alberta's done a great job, yet there's an outbreak here or there. British Columbia's done a great job. Frozen fruit factory has an outbreak. Israel's done a terrific job. Outbreak at a high school. South Korea's done a wonderful job. Outbreak at a nightclub. And this is just the patchy nature of the virus. It's actually, epidemiologic terms, and over-dispersed are not. It just basically means that, there's going to be a few people that are just shedding a lot of virus that are going to be responsible for the most transmission. I think we're going to see that moving forward.
Yeah, and if you look, like, Kwadwo, you were talking about like you're noticing there's a couple of articles that kind of put together our knowledge of these super spreading events, right? And for one comment you made is that all of them but one are inside. But the other thing is exactly that. It's like one thing that I've learned recently is that it's not that every person has the same potential of spreading the virus. Some people just don't, but some people, based on whatever biological reason, they might be shedding more virus, but they also say are in a job where they're like seeing tons of people during the day, right? And that's what I think that we'll see. So I think we should expect, as Isaac is alluding to, is that we should see, you're going to see outbreaks, and this is why track and trace is so important. The point is, you see this little fire, you go there, you put it out and try to prevent this big fire. And that's what's going to be the case over the next, several months. And, I'm not saying that I don't think a vaccine is going to come. I'm just a bit less optimistic than Isaac is, but I do think until then, things are going to be very different.
I don't want to take it in the wrong direction, but Kwadwo, are you seeing outpatients as well? Like, are you doing virtual care? Okay.
No, zero.
You're doing
zero.
ICU?
Just ICU. I normally do a little bit of palliative, but
nice.
And just focusing on the research of late. So,
fantastic.
But yeah, interesting, because there's a lot of theory out there that like when you look at other respiratory viruses, they seem to have like a natural curve, and they seem to decrease for whatever reason seasonally, like when we come into the summer months or whatever. Like it can't be just as simple as we're outside, is it? Or what's the theory behind this, in your humble opinions?
I got a few thoughts, and again, like, the short answer is I don't know. The longer answer is nobody knows. But here's a few theories. One is that this virus may very well end up being a seasonal virus. And it may very well, we know that it likes cooler climates, cooler temperatures better. It may very well morph into something where we see, seasonal variation and similar to like influenza season from November to February. It might turn into something like that. The thing is, in the context of a pandemic, those rules are kind of out the window, right? We talk about outdoors, we talk about sunlight, we talk about temperature, we talk about ultraviolet rays, all being factors that decrease viral transmission. Yet, this virus is exploding in Brazil, India, Bangladesh, Pakistan, Ecuador. I can go on and on and on. All those New Delhi was having 40 degrees Celsius today in sun, right? These are places with no shortage of heat, no shortage of ultraviolet rays, and yet the virus is taking off. So in the context of a pandemic, when the global burden is so large, I don't think those rules necessarily apply. Even if there is some mitigating factor of them, it's probably not going to be that measurable or that significant. Now, when the global burden goes down for whatever reason, vaccination, or we all just get this infection over the next few years, maybe it'll morph into that seasonal variation, but until then, I don't think we're going to see it. The other interesting thing is, it's not, I get it, this is a different virus, but we had a pandemic in 2008, 2009 with H1N1. That's a flu virus, right? The flu does not like summer warm months. The flu circulates in cooler temperatures, yet this exploded in summer months as well. You have a non-immune population. It's a respiratory virus that's easy to transmit from person to person, and it exploded in the summer months, and then it morphed into its seasonal variation again. So I don't think we're going to see anything like that until, a while down the line.
Sumon, I don't know if you have any more to add to that, or you just like, yeah, I totally agree.
No, I totally agree. But I think that the one thing is that the thing that's always scared me about these viruses, and remember, even though with this, we're seeing this pandemic, right? Remember, we also saw or at least a huge epidemic with things like Zika as well. And this has kind of been like the new rules that we're seeing, the new normal that we're seeing with the viruses. They come into a huge population because of ability to spread these things around the world, and then they explode. And it's unfortunately something I think that we haven't seen the last of. I don't think we necessarily will see another pandemic like this, but I think that we're going to be grappling with this. And I just hope that next time, including if there's a second wave, that we're able to actually be prepared for it and see it coming from miles away, rather than you have a tidal wave about to hit and you're protecting yourself.
Oh man, I mean, I've heard many experts say we saw this coming, and I think there's going to be a lot more respect. Hopefully there'll be investment, but a lot more respect for public health and respect for viruses, because this is not going to be the only one. Hopefully it won't be to this extent, but it won't be the only one.
Let's think about it. We've been lucky, right?
Yeah.
SARS in 2003.
Yeah.
What was after SARS? H1N1 in MERS. 2008, 2009. MERS came after that. Chikungunya landed from Africa/Asia into the Americas, swept through Latin America and the Caribbean. No one could move their elbows and knees for a year. Okay. Zika swept through Latin America and the Caribbean as well. Like, this is not unique in that a virus that's probably existed for millennia is introduced into a population and spreads like wildfire. Right. This has been happening with increasing frequency over the last 2 decades, and it will continue to happen. And a lot of this is basically related to, number one, humans encroaching into different territories and in close contact with non-human animals. And number two, human mobility. I mean, literally, this started in Wuhan, China. And before this, I would gamble that many people, at least in North America, had never heard of Wuhan, China, even though it's a city of 11 million people. Right. And then, 3 months later, 3 months after we even heard of something going on, I first heard of it on December 31st with the ProMed Mail report. 3 months later, there's a pandemic. It's phenomenal. It's phenomenal. But we kind of got lucky in the sense that it hasn't happened this frequently beforehand. And those other ones, we were able to, SARS we could quell, MERS we could quell, H1N1 swept through the world, but we got lucky that it's just influenza. Zika and chikungunya, I mean, those are terrible infections for a couple of different reasons, but you're only going to get those where you have the right mosquitoes, the right altitude, the right human host, the right climate. So that's not, it can spread, but it's not going to go everywhere on the planet. So it's interesting.
Yeah, no, it's crazy when you take a bird's eye view at all this. So just to get your answer to this directly, so like this second wave, do you anticipate, as I might have been preemptive in putting words in y'all's mouth, but like in the winter or in the late fall, like would your prediction be that we would get a second wave?
Yeah, I mean, I think that we should, like, for me, what I think is that we should expect it, right? And I've seen a lot of different models of what we're going to see. Are we going to see a massive one like 1918? I think that's the least likely situation, like a massive wave that's bigger than the one now. Are we going to see something? Yes. And I think that, like people said, is like in the respiratory virus season expected to come. And the question is, what do we see? Do we see a smaller wave? Do we see multiple small waves? Do you see one kind of like flat? It's hard to know. And a part of this also, I think that I really hope, and I am encouraged by the fact that I think that we will be much more ready for it, but it's something that it's really easy to want to kind of completely forget about this once this first wave is, we're coming to a conclusion, at least in Canada, but this thing is not going away anytime soon.
Mm.
I totally agree. I mean, I don't think it's a matter of, I think we are going to see one. It's just a matter of, do we have the capacity for early detection, and can we quell this before it turns into a large wave? And, people start debating, well, is this just a spike in your first wave? Is it a true second wave? Honestly, who cares? It's a spike in cases. Like, I mean, maybe the hardcore epidemiologists care, and they're going to, write me some angry letters and stuff. But like, a spike in cases is a spike in cases, whether or not it's a spike in the first wave or whether or not it's a distinct second wave. Like, I don't care. It's unacceptable either way. And we know how to detect and prevent that from happening, and we've got to do it. So, it's interesting. If you look at places that are a little farther ahead than us, I like the example of South Korea. I mean, they have really good early detection systems. They have amazing abilities to do contact tracing. And this nightclub case that we sort of chatted about earlier, one person was basically responsible for about 100 cases in South Korea when he was at a packed nightclub. It was great to watch South Korea respond to that. Number one, they started closing down the nightclubs again. Number two, they were able to contact trace like crazy. They were able to provide people with rapid, access, low barriers to diagnostic tests. They're able to tell who was there, who are the secondary possible cases, provide people and support people through a 14-day period of isolation. Like, that's the kind of thing that will prevent a second wave from happening. Early detection systems, timely access to diagnostic tests and diagnostic capacity, rapid ability to perform contact tracing, and ability to support people through a 14-day period of isolation, those who are infected and those who are close contacts. And if we have that dialed in, I think we'll do okay. But, you look at scenes in the southern United States where it's almost like there was never, ever a coronavirus pandemic. And you see, like, Tel Surprise, Arizona has like limited ICU capacity right now, and they don't have any ECMO capacity because they're just getting smoked. Florida's taking off. I think there's 21 states that are on this trajectory. This we know how to prevent this. I mean, we know how to prevent this. We've been there, and there's lessons to be learned. And it's just really upsetting to watch this happen. I think the place that's actually truly having like a true definition of a second wave right now is Iran. And if you look at the cases in Iran, they had a big spike in cases. It's come down, and now they're having another big spike in cases. This is what's reported, but it's about 3,000 new cases per day. So
Wow.
I think they sort of lifted their restrictions prematurely and went back to normal. And they don't call them communicable diseases for nothing.
Yeah.
Wow. And so they and when you say reduced restrictions, they go back to normal, or did they? Yeah. Wow.
You can see
It
all
looks
the
like it.
videos.
It's hard to know because you never know.
Trains, right?
Yeah.
Yeah, it's hard to know, but it appears that's the case. But I mean, did you guys see the scenes out of? I saw some media outlet. Like, there's scenes out of Las Vegas from last week.
Yeah.
Where it was just like, there's just a million people walking around. It's indoors. No one's wearing masks. They're at the casinos. It's packed. Like, come on. I mean, you don't need a crystal ball to predict what's going to happen there. Like, you know what's going to happen. It's inevitable. It's inevitable.
Yeah.
Wow. No,
Really
it's
upsetting.
So what do you guys think in terms of the level of exposure? We'll say, like, mostly in Canada or Ontario, Toronto, wherever is easier to give an example. Like, you often hear about people, your neighbor or colleague saying, back in February, I was having all these symptoms. I was achy, you know what I'm saying? And I got my flu shot. And, part of me really wonders is like, was there way more exposure than we thought or think there was? Like, is there going to be more people that have been exposed and maybe have a certain level of herd immunity? I know that's a taboo term these days for whatever reason, but
Great term, man. I love it.
I love it too, but I don't know. I don't even know why I said that's a taboo term. But yeah, do you guys have a sense of, like, do you think it's more ubiquitous than we say it is, or
Well, I mean, like, remember at the very beginning of this, like, there was some like sentinel testing. They're kind of like reaching into the community in February and March to see if they could see where there was community spread. And the thing is that most of us think there probably was. And I'll be honest with you, I didn't believe there was at the time, but now kind of looking back, I think there certainly was earlier than we expected. We still got lucky because we were able to kind of put our lockdown in before the inflection point before it started, going up exponentially. But I do certainly think that there's a lot to the fact that people thinking, you know what, I had this weird flu that I've never had my entire life sometime in late February. And, if we ever get a reliable widespread serology test that will tell you that, you've been exposed to SARS-CoV-2, it might be really interesting to, do a seroprevalence and see, oh, you're positive for it. And, you've never really, you never really knew it. Or that cold that you had back in February may have been this. It looks like it was there before we really knew about it. It was in our midst.
Yeah. I'm allowed to drink scotch on the podcast.
Yeah,
right?
yeah, Scott, 100%. I'm kind of wishing
just
that I'm like empty nester. My family's out of town, so I was no one's there to get me some scotch myself. So I'm sipping this water.
My daughter.
So I agree with Sumon, but honestly, I don't think there's like the short answer is I don't know. We'll have these answers sooner or later when we have serologic tests available. But in the early days, at least in Canada, we didn't have the best diagnostic capacity. I thought we did, but we actually didn't. And we know lots of people are getting turned away from COVID testing centers. That was really disappointing to see. I'm sure a lot of those people actually had COVID-19 infections. And there was just a laboratory capacity issue at that time. I think throughout most of the country, that's largely been remedied. But so like at the end of the day, someone said, I was really sick in January. I was really sick in February. Was that COVID? Yeah, there's still a ton of influenza going on around that time as well. And, before the lockdown, it was a pretty bad influenza season, all things considered. So I think there's a lot of influenza that people think was COVID, but still at the end of the day, because so many people were turned away from COVID-19 testing centers, our numbers are obviously undercalling it. I mean, those are the best numbers we have. And there's going to be significantly more people that had this infection than what our numbers suggest. But having said that, I don't think it's going to be like some tremendous value where we're just going to see, large swaths of the population positive for this infection. I actually think it's going to be surprisingly underwhelming. That'd be my guess.
It's kind of concerning, right?
The only reason I say that is because when we look at some of these places that were smoked, you look at like the hardest hit neighborhoods in New York and something like that, and there's a place in Germany that was significantly impacted. Like these were truly healthcare systems that were stretched beyond capacity. Like these were the heaviest hit places. And like the seroprevalence in the heaviest hit neighborhoods of the heaviest hit places is something like 20%. So when you think of that and you think about like Canada, it's probably going to be a hell of a lot less, even in the heaviest hit neighborhoods as of now. I mean, obviously, as we move forward, there's just going to be more and more and more infection in the pre-vaccine era. But as of now, I think it's probably a lot less than many people might think.
Yeah. Is it? And this might sound random, but is that good? And you know what I mean? Like I know we're leaning on this vaccine. Personally, I'm a bit pessimistic in terms of the vaccine. Just from my talks, we had Paul Offit on. He developed the rotavirus vaccine, and just really clarifying the steps needed to establish this. And I mean, this is years ago, but it took him 25 years, and we're talking about doing something in 18 months to 2 years. I almost wish, like my dream is that we've had way more exposure than we think, so that there's a level of more herd immunity. But that's just, there's nothing really to back that, I guess.
I was thinking at the beginning of this whole thing, like, so I got, I think Isaac as well, we both gotten swabbed a couple of times. So I got swabbed, and I was actually almost hoping it was positive. Number one, that I didn't feel that sick. It was very, very mild, right? Yeah. And then after that, like you have this, you probably do have some short-term immunity, and then it's is a bit of a weight off your chest. But yeah, I think that overall, it's a lot of what we've been doing has been concentrating on deaths. People have been saying, okay, deaths. But the thing is, the biggest issue with this is not deaths necessarily. It's the fact that it is such explosive growth that can then overwhelm a system. And once you overwhelm your hospital system, that's when things just don't work anymore. And, people are getting exposed, PPE runs out, what we saw in New York City. So I think that's the thing, is that at so long as we have a low amount of immunity in the population, there's a potential for that happening. I don't think it's going to happen here. I think we're going to be able to deal with anything, but any future waves, but it's always there. And I don't know, what do you think, Isaac? 5%? 10%?
Yeah, probably. I think you raise a really cool point, though, that I've noticed as well. And it's when you're dealing with it's mostly in my interactions with healthcare providers, but I've had this with a couple of patients as well. When we've done the diagnostic test and it was negative, and we can talk about false negatives another time, but the psychology of, damn it, I wish it was positive. Why could that have been my COVID illness? I just want to get it over with. And I appreciate I'm probably immune, at least to some extent, for some period of time. And that is a very common, it's almost like a unanimous answer whenever you deliver the news that the COVID test is negative.
Yeah.
And if people are well,
Yeah. I mean, when all this came out, the whole idea was flatten the curve. This is extremely contagious. The idea is we're probably going to have exposure to it. I've always assumed that I'd be exposed, it's coming eventually. It's just a matter of when. But one of the issues I found is I always feel like our goals are changing frequently. Is it really making sure our system isn't overrun, or is it, you'll hear people say let's not flatten the curve, let's get it to zero. But part of the thing with our show too is we talk a lot about the consequences of lockdown, of not being, when it comes to the kids, there's more abuse, there's domestic abuse, there's people not coming into hospital, there's the cancer screening is not happening. There's a ton of
disproportionately affecting women at the home. Absolutely.
It's so I think that's been one of my biggest pet peeves in this whole discussion, is really looking at public health in a big scope. Who else is being affected, even if they don't have the diagnosis of COVID. But yeah, I just hope that our goals are realistic, and we always consider those that are being impacted as well. Speaking of kids, actually, this was a monster topic that came up a million times when we were promoting the show. Was your thoughts on kids going back to school and the worry about packages, kids going back to school, them getting sick, Kawasaki's if you want. Any thoughts towards any of that business?
It's going to happen. I think it's going to happen, right? If schools go back, you take all the safeguards in place, you put the desks in the gym, you spread them apart by 2 meters, even if you make the kids wear masks, which I have no idea how the hell you're going to do that. But if you do everything right, there's still going to be an outbreak in a school at some place. You can do everything you can to lower the risk. You can do everything you can to reduce the risk of transmission. If it is introduced, there's still going to be a school outbreak. There's still going to be a bunch of kids sent home for 14 days of quarantine. It's still going to have, as you point out, I really love that you point out, it's a lot more than health here. Public health is a lot more than physical health, right? There's tremendous negative economic impacts, because that means a parent probably has to stay home, and that means there's less income in the family, and that means they have trouble paying their mortgage, and that means there's going to be, that can translate to a lot of different things. So this has a tremendous ripple effect. But
I think another thing that's a really good point, Isaac, because I think that we have to be. I find a lot of people kind of put this dichotomy between economy and health, right? Yeah. Oh, you just care about money. That's why. No, absolutely not. I think that there's lots of these unintended consequences with this lockdown. Lockdown, we had to do it. We had to do it, but there's all sorts of downstream consequences. If I can make one thing about the comment about the school, I was thinking about this a lot, and I think that at some point we have to assume we're going to see cases, right? And what can we do to kind of mitigate the harm that's going to happen from that? So let's say, what are the harmful things? If you have a teacher, for example, who's older, over the age of 60, because when kids get it, they don't get that sick. Yes, the Kawasaki thing happens, but it's so rare. right?
Mhm.
So what can we do? Can we make things so that, okay, if there's a virtual option for kids who have other issues, or they live at home with grandpa and grandma, what we have to do, kind of looking at the situation where school can happen, but we mitigate whatever risks we can. It's going to be a messy situation. I don't know how we're going to deal with it, but I think that we can't have a realistic, it's not a realistic goal, I mean, to have no cases all. They're going to happen. And we have to kind of roll with the punches.
Yeah,
Yeah,
and
I'm with
maybe
you
it
all the
just
way.
comes down to, as you guys were saying, like, rapid contact tracing, like just shut it down. Is like have that heightened awareness in the schools that once there's some cases there that get the kids isolated and do the contact tracing. But that's my point of view, is like it's coming. And to think like Isaac, I don't know, how old are your kids, Isaac?
I have to ask my wife. I'm not sure. Oh, they're 6 and 8.
Yeah. To expect like my boys to like be distant all the time, wear masks.
Not a chance.
I can't get my daughter to wear a diaper, man.
Yeah.
How is she going to wear a mask?
Absolutely. Yeah. Like it's like, so I think, in my opinion, if you're opening schools, you're opening schools. And, but like, luckily.
But it's like living with uncertainty, right? I mean,
yeah.
I think I was incorrect. I kept saying, we have to get used to living with uncertainty. You don't have to get used to anything, right? Some people just can't do that. That's okay. But regardless of what we're used to and what we're not used to, there is uncertainty. Mm-hmm. There is uncertainty. And until we have a durable solution out of this shitstorm that we're in, there is uncertainty. Mm-hmm. And the durable solution, hopefully, is a vaccine that will hopefully be protective, that will hopefully come soon, that will hopefully be readily available to the world, that will hopefully be readily available to the world in a meaningful time because we have the means to mass produce it and distribute it, that will hopefully be equitably distributed. Like, there's a lot of hopefuls there. And, Jupiter's really got to align with Mars for that to happen. And until that happens, there is uncertainty. Whether or not we're comfortable with it is up to us, but there is uncertainty.
Yeah, it's like everything else. Like there's going to be a certain level of risk, and we just have to decide collectively, like what's that acceptable level.
Absolutely, and individually,
yeah,
right?
Absolutely,
like,
100%.
Hey, listen, haircuts. Maybe you can get a haircut. Well, listen. For me to get a haircut, maybe it's a lot, which I need. By the way, I'm like glued down here. But like for me to get a haircut, that might be very different from someone who lives in a multi-generational home with a 92-year-old frail grandmother there, right? I don't have that. And the consequences might be very different for different people. So people's risk threshold, people's risk perception, people's personal circumstances, that's probably going to dictate a lot of their behaviors, and the consequences of interacting with the world around you is going to be very different for different people. So it's there's and yet again, there's a lot of uncertainty. Such
a great point. Like I gave a talk last week to a group of psychologists about reopening, and to me, I'm like, especially with you guys having to be engaged with your client and everything, it's like, what level of risk is acceptable for you? If you're not comfortable with shit, like, do it virtually. Don't risk it, because it's going to affect your care. But yeah, to me, those are fantastic points. We're gonna take some questions that are from the audience, and some of them were put up on Twitter and other social media. So here's I think an easy
give the hard ones to him, okay?
Yeah.
I was gonna be like, I've got a question. Like, Sumon, in 2008, how come you were really late when we were supposed to meet at that play?
Right.
It was a musical, right? But okay, let's see this. What are the thresholds for opening up? Were you guys comfortable with the threshold for opening up, or do you think we're doing it too soon? Do you think you're doing it too late? I actually have a strong opinion about this too, actually. How do you guys feel about
going first? Jack, you want to do
Sumon?
Yeah, I'll go. I'll be honest. I think that we needed to do something. I think that the fact that we opened up, I think that we opened up at a right time. Could it have been too early? Sure. But I think the biggest part about this is that they have a monitoring system where they're looking to see what happens. If we open and we're moving forward, and all of a sudden we start to see a lot of cases, we have a plan to either stay still or move back into more restrictions. So as long as it's something that's being done systematically, it's okay. We don't have to be perfect. I think a lot of people who, they want zero risk when they're going to be opening up. And we can't do that. And I'm very, my sister's in business. I've talked a lot about with her, some of the things that we don't think about in healthcare, things like the supply chain. She was explaining to me, if you get to this point where the supply chain is messed up, that could be messed up, I don't say permanently, but for a long period of time. And then all of a sudden there's food security issues, right? It's very easy for me to say everybody stay in lockdown, but if we start to have that issue, it's not good. So that's what I think. What do you think, Isaac?
I like the regional approach that we took. I mean, it was ridiculous that Toronto is ruining it for the rest of Ontario.
Exactly. Preach, boy.
Okay, so
you are in the universe, though, guys. Come on.
Kingston, Timmins, Kenora, Thunder Bay. These poor small business owners are on lockdown because we can't get our shit together in the GTA. And we'll get it figured out. And I get it. People travel, people move. You can go from the GTA and go to, North Bay for a haircut. But if you have those steps in place for early detection and you take the steps to prevent introduction and transmission, it's not fair to hold other people back. And you just think about, forget the health repercussions. Think about the tremendous economic and sociologic repercussions of having people on lockdown that are 1,000 kilometers away that have next to nothing of a risk. So I like that regional approach. Alberta did it. They left Calgary and Brooks behind. Quebec did it. They left Montreal behind. And I'm finally glad Ontario got it together and left the GTA. Sadly, that I'm in the GTA right now and still can't get a haircut. But hey, we'll wait our turn until we're good and ready. But we just weren't yet. So I think that was a smart approach. I'm really glad they finally did it.
But you guys, I was going to go off on this topic, but you hit my points, the regional aspect. That it just was nonsensical, and just the delays. When I still think of our cancer patients not getting screened and delayed surgeries. This is going to be a real issue. Actually, we're releasing a show. Do you guys know Sebastian Rodriguez? Do you know him?
Yeah, from Western.
From Western. Yeah. No, yeah, we have him on talking about wait times and what to expect here, because it's not going to be pretty. It ain't going to be pretty.
Yeah.
He's orthopedics now, is that right?
Yeah, he does ortho. Yeah. He's
wow, we're not allowed to hang out with those guys. We're the losers in infectious diseases. We're on the totem pole. We're somewhere down here.
Yeah.
Listen, it takes a lot of effort to increase the dose of ceftriaxone. Okay, it hurt my wrist to write that today. So
totally unrelated. But you think about what they do during a day. People crawl into hospital and then they tear out, cut out an acetabulum and replace it and hammer it in. They do amazing things. People walk out of hospital and Sumon and I basically write piece of vancomycin from 1.25 grams to 1 gram, Q12 hours. And we're oh yeah.
You want to change it to Q8? You want to change it to Q8? Yeah,
exactly.
No, it's so true. Actually, it's funny. I used to bug me a bit to be stereotyped to be are you ortho? And now I take it as a compliment. I'm yeah, I'm ortho.
Yeah.
They get it done. There's a lot of people that get it done.
Exactly.
It's impressive.
Okay, how do we approach the safe reunion of couples who've been living in separate homes and who have been requiring to social distance for the last few months? Do you like that one? I don't know if I like that one. I could skip that one.
Listen, I think the key, it's pretty quick, right? You adhere to the local public health guidelines. If you're allowed to get together, get together. If you're not, don't. And again, sort of as we were talking about earlier, everyone's individual circumstances are going to be different. If there's going to be the risk of introducing this to someone who's frail or going to have a poor outcome, maybe think twice about it. If there's a lower risk, go for it.
I'll say one thing that's really important, I think, with this is that we have to also remember that right now, the number of cases that are in the community today is much less than it was in March and April, right? So there's a risk that you can bring it home to your wife or, if you're a healthcare worker, for example, but that risk is much smaller than it was before.
Yeah.
Mm-hmm. Good. Let's see. Where is that? Yeah, I could use some of that right now too. Given the local person house, do you think we've been locked down? Yeah, I've covered that. We've covered this. I'm going to have one of my own questions actually that come up a lot. Vitamin D status and COVID-19.
Sumon, you take this one first. I want to hear what you got to say.
Yeah, okay. So this, you know what, vitamin D has been something that's kind of, so this is what I noticed, that whenever any of these kind of new illnesses come out, you'll see like these analyses done where you're going to throw a whole bunch of things up against the wall and see what sticks, right? Listen, we do know that vitamin D is associated with low vitamin D status is associated with worsening, for example, TB. It's one of the things that we have a pretty good association. We've seen things with blood type, we've seen smoking status. I think the biggest things that we're seeing right now in terms of a good tight correlation is vascular risk factors tend to be a big thing, like diabetes, hypertension, and age, right? Vitamin D status, I've seen it. I'm not really sure what to make of the link, but to my knowledge, I don't know of anything that's strong. But Isaac, take it away. Do you know more?
Oh, okay. So, I mean, listen, like I like to call these DFZs. We're in the data-free zone. And some people say precautionary principle. It does, what's the harm? Everyone should be on vitamin D. In all fairness, like, let's just make again, I could be wrong. I'm allowed to make predictions, and I appreciate being wrong. The point is, I'm totally open-minded to the data, totally open-minded to changing practice. I'm just sort of skeptical that I wonder at the end of the day, if the thought is, if people are supplemented with vitamin D because they're slightly deficient, will that have a meaningful impact on whether or not they get severe or less severe COVID-19 infection? I'm a little skeptical of that. I am. Listen, if you're vitamin D deficient, you should take vitamin D. But on the other hand, is that truly going to help you? Is that truly going to have a protective effect? Listen, these are answerable questions. Like, these are easy trials to run. It might be harder because we're seeing fewer and fewer cases, but like, these are answerable questions. And like, I'm a little skeptical on that. And then, here comes the hate mail, right? Oh, precautionary principles. Oh, what's the harm? Oh, you should see this data from the Journal of Null Results from 2001. Like, and everyone throws crap at you in your email and you go delete. Show me some good data, or like, give me a real hypothesis. And, I'm totally open-minded to it, but I don't think it'll pan out. I hope I'm wrong. Like, at the end of the day,
yeah.
I hope, because it would be amazing. Like, if it's really that simple, it would be phenomenal. I would love that. Just like hydroxychloroquine. It would be amazing if that worked.
Wait,
like,
that doesn't work, right?
But like, I just don't think it's going to be as simple as that. I really don't.
Yeah. My personal belief is like, I don't know. Looking at the evidence, there seems to be a correlation. The part of that though is like, I think if you have chronic illness, a lot of people are vitamin D deficient, right? So I think they have a tough time like really sussing that out.
Oh yeah.
But but for me though, I'm of a believer that just in medicine in general, if there's little harm, why not? You know what I mean? That's my philosophy. If it's might be a little bit of 80-20 in there and saying like a small intervention that has a big bang, who knows? But certainly if it was something
but
that's
a different point, right? That's a different question. That's we're going to supplement the vitamin D. The next question is it actually doing anything is the question, right? Yeah. Like, exactly. I don't think it is. And maybe it is. I hope it is, but I don't know if it will.
Yeah. And remember also,
but it's a good point.
Like, one thing that kind of makes me uncomfortable about the precautionary principle, and I'm not saying, by the way, Kwadwo, that I necessarily disagree. It's just that sometimes like it starts to kind of be a bit of a slippery slope. So people say, hey, why not give them ceftriaxone? Why not give them azithromycin? But the thing is, we do know that later on we'll often find harm, right? Yeah. So, these things like certain innocuous drugs can, of course, they can become toxic in certain situations. So that's why I think with us, when I first started out, this is where I have evolved. I was giving hydroxychloroquine to the first people coming in with COVID, right? Way back in March. We, of course, saw our first case before Dr. Bogoch did. So that's another thing.
100%. 100%.
So, but then later on, I think we took the position. I think this is the right one: is to try not to use things that are outside of a clinical trial. And that's the way that I think, just with the mess of what we've seen with all these different drugs, ivermectin, hydroxychloroquine, azithromycin. I think it's just, you want to avoid that, and that's the way that I've looked at it for the past couple months.
Yeah, no, I think that those are fair points. Definitely the slippery slope you worry about, and but yeah, I mean, the interesting thing too, I this is not an ID talk, but it's just the thing that I still bothers me, just because I got an audience, is that, when you see the patients that do poorly, it's like you guys said, they have those vascular risk factors and stuff.
Yeah.
And I don't know, to me, while there's a lull, I would really love public health and health practitioners like ourselves to say, like, you know what, let's do our best to get healthy. Let's amp up our nutrition. Let's exercise. Let's give ourselves the best chance. And
stop smoking.
Exactly. Yeah. Big one.
Yeah.
Stop. And, I think that would be, because people, I know behaviorally it's hard for people to do things like that, but they're scared as shit about COVID. People are like, you know what I mean? So like, maybe this is the push. But
great idea.
You know what I mean? Like, just
that's a great idea, right? Like the worst, you're looking for motivation. Here it is. Hey, someone with uncontrolled diabetes, really, uncontrolled hypertension, 2-pack a day smoker. Like, you're in the middle of a pandemic. We know these are risk factors for poor outcome. What better motive? We don't have a vaccine. There's no real treatment for this. We have no other drugs to prevent it. The best prevention is to hide inside your house and distance yourself from others. Like, it's a matter of time. You're sitting duck for severe infection. I think that's brilliant. That's brilliant. Jump on it, right? Here's a great motivating tool to get people to get in shape, eat well, quit smoking, go to their primary care provider, get their blood pressure taken care of. That's a great idea. How do you harness that though? Like, what do you do? Like, how do you?
Well, I mean, this is a self-promotion. This is a direction we're going in the show, like how people could just take control of some of these things. Like, I don't know if, it's another self-plug, but Jason Fung's stuff with the intermittent fasting, man, like when you see people like literally come off the diabetic meds by the timing of when they eat, like, to me, it's like such a, I can't believe we don't scale this up and promote this more. There's all these, like, to me, it's like you mentioned 80-20. That's like my mantra for life. Always looking at the most efficient way of like getting the biggest bang for your buck. And, whether that's exercise, like if you're capable, middle-aged guys, doing some like more HIIT exercises, stuff that only takes, 10 minutes of your day, just walking. But like, in terms of diet, like whether you have a low carb approach or whether you just fast, like these are things that aren't impossible, but I think could have a lot of headway. So hopefully we could educate more people on this stuff.
Great.
Yeah, appreciate it. We're going to do maybe one more question, I think. Okay. I think I know the answer to this, though, but I don't want.
Those are the best ones to give in this, so then we can look like you're smart, right?
Okay, so this is definitely going towards Sumon. You said you wouldn't attend a Tool concert for the next year or two, but do you think it would be safe to attend a professional conference or trade show before vaccine is available?
Yeah, so it's a good point. And again, like, I think that it depends on the circumstances. I think Isaac's kind of alluded to this a number of times, that you have to kind of think about the whole situation, right? And, is it indoors? What's the setup like? Are you in like a massive room where everything is spread out, or are you in like a hall where everybody's talking and it's going to be funny, lots of people laughing, poor ventilation, old building, that type of thing. I think that it's difficult for a conference to at this point occur, just because you need a certain critical mass, and without that you don't really have a conference. And I think that right now, mass gatherings, I think, are one of the biggest things. When you look at any of the guidelines for pandemic management, mass mass gatherings are one of the last things that you take the restrictions off of. And, a trade conference. Now, I have seen some outdoor trade conferences, and I think that's a bit different. If you limit the number of people that are there and it's outdoors, I think that would be okay. But the indoor stuff, I think that it's going to be a long time. It'll come back at the same time as I'm rocking to Tool.
Why Tool?
I love them, man. It's just all that weird meter stuff and like the dark sound.
Oh man, while I have an audience, you have to hear the new Run the Jewel album. I know it's different.
I love it.
It is
It's amazing.
Oh, I heard it on the way home yesterday.
Those guys are brilliant.
Oh, and they're middle-aged men doing hip hop.
That's right. Atlanta, these like 45-year-old sort of fat guy.
Oh, it is like out of bounds, man.
Amazing.
40-year-olds can still do things, Isaac. Okay.
Are
we middle-aged?
Yeah. I love all Run the Jewel, but even the first track, they just come with it. They just come with it. I was just like, I was walking up and I stopped what I was doing. And I just started just bobbing my head like this. All my neighbors are like, what time is it? And I'm like, it's game time right now, man. RTJ all day.
I was cranking that. I know I'm not the demographic, but I don't care. I was cranking that in the car on the way to work the other day.
Oh, it's so good.
That is a great album.
Oh, yes, all day. So I think the answer for that, I think we are all in agreement. When you're inside, it's just that much more risky. I think we're not going to see, unfortunately, NHL games or NBA games anytime soon. And although you know what, there are the talks. Audiences
baseball right now is the whole thing of playing without people.
Sorry, that's what I meant, without audience. Sorry.
Yeah. It's a bummer. It's a total bummer. But I think this is necessary. And I'm just going to be interested to see, what. I get it. The first stage is no odd. You're not going to have any conferences. You're not going to have any tons of people under one roof. Okay, that's easy. But is there going to be a point in time in the pre-vaccine era where we gradually scale up? Can you envision, a Raptors game where they're going to sell 1 out of 10 seats? Or something. I'm just making up that number. And, do crowd control coming in and crowd control coming out and hand sanitation stations every 5 seconds. No crowding in the bathroom. And, they think about every little thing. I just wonder, I'm just curious. I have no idea what the answer is, but I wonder, what's that next? Is there a next step above playing in front of no audience to playing in front of a very small audience? Do they gradually build up on that depending on? I'd love to know what's going through their mind.
I think it's going to be very dependent on the league. There's the NFL, for example, their revenue from ticket sales isn't as significant compared to NBA, where they have 42 home games, or the NHL. So I think you'll probably see a push, but it's like anything else, sometimes a level of nuance makes things a little bit it scares people away. But what you're describing doesn't sound unreasonable, especially as cases seem to be, flattened. But I don't know.
I'm just curious. I have no idea what's going to happen.
That's why you have to be a fan. Be a fan of these non-team sports. When you watch tennis is naturally socially distanced. Okay, and you can watch Nadal and Federer play all day. I'll get to enjoy sports before you guys will. Although I'm a hockey fan too. So.
Yeah, you could stick with your Nadal. I got my McDavid. Okay.
Yeah.
But boys,
why Edmonton? I'm
from Edmonton. I'm from Edmonton. I'm born and raised. Are you serious?
Oh, we're mortal enemies.
Yeah.
Oh my God, Battle of Alberta. Hey.
Oh yeah. And before the COVID, it got real too, man.
Oh, I loved it. It was finally fantastic. It's nice to have that back.
Yeah, it was good. Testy games and stuff. Yeah, it's.
What are your thoughts on Tkachuk Jr.?
Oh, he's awesome. I hate to it's hard to be objective, but who wouldn't take that kid on your team?
Oh my God, that guy just in front of the net, he can do anything he wants.
Oh, all the Tkachuks actually.
Yeah,
precious,
feisty
for real. Listen, boys, I gotta tell you, this was a lot of fun. I feel like it was like a social event, but sprinkling in a little bit of knowledge and game. You know what I'm saying? I didn't have too much to say, but you guys, was just great to hear from the experts, like, you know, what to expect in the future. Like, what do we really, what's COVID, like, what's our new normal going to look like? And I think people that are listening now will have that better perspective and, you know, reason for optimism that we'll have some level of normal life. But, you know, we got to be used to living with COVID, you know, ultimately.
Yeah.
And, but yeah, you guys were awesome. Next time.
Thanks for having me on. It was really nice to meet you finally. I was looking forward to this all week. This is exciting.
Me too, actually.
And remember,
next time
now that Isaac's
we'll have
been on
cheers.
here, I have been on here 2 more times than him. So it just that we have to maintain that difference, right?
You know what? We can fix that.
I'm glad we're physically distanced right now, Sumon.
All right, guys. Thanks so much.
Take it easy. Have a good one,
guys.
You too.